The 2020 election has put Medicare for All on center stage.
And we have got to pass a Medicare for all single-payer system.
Getting to guaranteed, high-quality, universal health care as quickly and surely as possible has to be our goal.
Medicare for All solves that problem.
It's no secret that many are unsatisfied with today's healthcare system. Nearly 11% of people under 65 are uninsured, and nearly 16% are insured but struggle with affordability. So it's no surprise that Medicare for All has broad support among the public, at least according to some general polls. The specifics get a bit trickier, and that's in part due to terminology. There's general confusion over the interpretation of what is covered within Medicare and who is covered by the all, even among the policymakers themselves.
Why do you have to go all the way to Medicare for All?
But again, this is what I'm saying. First of all, a lot of people use that term and there's differentiation about what they actually believe.
Johnson brings up Medicare.
Established in 1965, Medicare is a federal health insurance program for people 65 and older. And 54 years later, it's ranked as the second most important government-run program after Social Security. Medicare for All as a concept has been around for decades, but today, some policymakers are using the term pretty loosely.
It's very similar. I would call it Medicare for all who want it. You take something like Medicare, a flavor of that, and you make it available on the exchanges.
Within the healthcare community, the definition of Medicare for All is quite exact: a government-funded, single-payer healthcare system, basically ensuring everyone under one public health plan.
I believe in a healthcare system that guarantees healthcare to all people in a cost-effective way, which is what Medicare for All is.
Of all the varying healthcare plans being proposed, there are two that stand out as aligning most closely with the original healthcare community's definition. Those are the plans put forth by Senator Bernie Sanders of Vermont and Representative Pramila Jayapal of Washington State. Their plans move all U.S. residents into a new and essentially unrecognizable Medicare program, eliminating premiums and virtually all cost sharing. The public plan covers a lot, including vision, dental, and prescription drugs. And with this newest version of Sanders' plan, both also now cover long-term care. Medicare for All would pretty much eliminate private insurance. So the idea is that everyone has access to the same doctors and the same kind of healthcare. The bills don't specify how much the government will finance free healthcare for all, so it's hard to know exactly how much it'll cost the government, or you. Tax increases are likely, but who and how much are still to be determined. And some of those taxes could be offset by the disappearance of premiums and medical bills. Today, 160 million Americans are insured through their employers. So eliminating nearly all private health insurance would dramatically disrupt the current healthcare system and essentially create an entirely new one. And concerns about that disruption are reflected in polling. While there's broad support for Medicare for All generally, when polls ask specifically about eliminating private health insurance plans, that support drops significantly.
Senator Klobuchar, let me put the question to you. You're one of the Democrats who wants to keep private insurance in addition to a government health care plan. Why is an incremental approach, in your view, better than a sweeping over?
I am just simply concerned about kicking half of America off of their health insurance in 4 years.
Other lawmakers, wary of the massive overhaul, develop plans to keep private health insurance as an option.
I think that this plan has the ability to unite Americans, some of whom may not be ready to adopt a Medicare for All system overnight, but who do want the option to be able to choose for themselves whether they want to get into the Medicare program and can't today.
3 propose the creation of an opt-in government-sponsored Medicare program while maintaining private plans, so people have the option to buy public insurance if they want. They cover roughly 60 to 80% of medical costs, depending on how much patients earn. Unlike Medicare for All, patients continue to pay premiums for healthcare. The biggest difference between the plans is how people would access the public option. On one end of the spectrum, employers get to decide if they would allow employees to buy public insurance. On the other end, only smaller companies would be allowed to provide that option. Larger companies would be barred from the exchange. Then in December 2018, Representatives Rosa DeLauro of Connecticut and Jan Schakowsky of Illinois tried to strike a middle ground, which essentially moves everyone into a public plan.
I'm also the co-sponsor of Medicare for America. I'm for improving it. I'm for all the plans because what we have now is not working.
Under this bill, who participates in the public option would change over time. Anyone who's uninsured, gets their insurance through the Obamacare marketplace, is on Medicaid, and newborns would automatically be enrolled in the public program. That means that eventually everyone would be enrolled and employer-sponsored programs would be phased out. Patients would still pay premiums and out-of-pocket costs, but those would be calculated on a sliding scale based on income.
If we were to start from scratch, maybe we would start with a single payer, but we've got to work with the system that we have here today. The surest, quickest way to get there is Medicare for America.
At the other end of the spectrum are the plans that really can't be confused for Medicare for All, but would still be considered expansions of the current healthcare system. One plan would make Medicaid a program primarily for low-income people available to everyone. Another plan would lower the age requirement for Medicare by 15 years.
This goes right to that group of people that have the most concern and anxiety about whether they're going to have affordable health care.
The array of healthcare plans proposed is large and varied. And with such a complicated system, it can be hard to keep track of the subtle policy differences. So the next time you hear a candidate proposing
Medicare for all,
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 it's best to ask for the specifics.